This is my Unit 14 assessment of diabetes and living a healthy life. Diabetes is a disease, and it's where the body's ability to produce or respond to insulin is impaired, which results then in abnormal metabolism and elevated levels of glucose in the bloodstream. There are differences between type 1 and type 2 diabetes. Type 1 is the smaller percentage of overall people, which only goes from about 5 to 10%. It cannot be prevented, and it's where the pancreas produces little to no insulin. Type 2 diabetes is the larger percentage, ranging from 90 to 95% of overall people with diabetes. It can be prevented, and the body cannot use insulin correctly. The type 1 diabetes needs to be inherited from both parents for you to have a greater risk of getting diabetes, but yet many people who are at risk for type 1 diabetes do not get it in the end. And it has been shown in a study that if your relatives had diabetes and you're at risk, you already had antibodies in your blood before contracting the disease. Type 2, it typically runs in the family more. You don't necessarily need to get it from both parents. It's not inherent from both of them. And that's because in your family you have very common dietary and exercise habits. So the negative impact on the body of diabetes would be high blood pressure and high cholesterol. And the high cholesterol then leads to an increased risk of heart attacks and cardiovascular disease. And high blood pressure and cholesterol lead to an increased risk of strokes. You also get diabetic retinopathy, which is the blood vessels in your eyes swelling and then leaking. It can be prevented if you get yearly screenings. There's also diabetic nephropathy, which is kidney disease and damage, and there's neuropathy, which is nerve damage. Who's at risk for type 2 diabetes? It'd be very more common if you have a family history of type 2 diabetes, heart disease, or stroke. If you have high weight, so if you're overweight or obese, have high blood pressure or high levels of triglycerides, if you have low levels of HDL or low physical activity, if you are over the age of 45, or if you have depression or polycystic ovary syndrome. Lifestyle choices can be made to help avoid contracting type 2 diabetes, and you can do that by you want to keep your blood sugar levels in the same range, in the correct range. And you can do it by eating correct food, so using correct portion sizes, balancing your meals, counting your carbohydrate intake, and avoiding sweetened sugars. And by exercising, by sticking to an exercise plan and schedule, staying hydrated, and always being prepared by bringing a snack with you just in case your levels don't stay in the right range. And this is my bibliography of all the sites that I use to help finish my presentation.